Pérez. And we will begin with the presentation of Dr. Fabián Pérez with extreme laser makeover by CO2. Should we continue in Spanish? Yes. All right, so my presentation, could you please help me show it? So the title of my talk is, sorry, I didn't get that, but I will basically compare. So the name of my presentation is Extreme Laser Makeover by CO2, and I will talk about low density points, and then you can conclude, if you like these results, to try to apply this with similar energies. These are my conflicts of interest. So the facial laser classical indications are facial resurfacing, acne sequelae treatment, and skin tightening, and other epidermal lesions such as keratosis, warts, nevi, that we can eliminate. And I will focus on these last three. And within the non-classical indications, which I like to explore, I will show you how, acting on these 4 points, I can obtain this recovery. So these are my tools. I use them on a daily basis. I see around 35 to 40 patients on average on a daily basis, and I choose if I apply an iPixel CO2 or a Pico Plus, a nanolight, a diode, or a high frequency, where I have different handheld devices. These phrases are constantly in my head, which are better and fast results, worse PT recover time, and less and slow results, gentle PT recover time. And I always warn my patients with these. And together with my patient, I take the decision, because this should be a joint decision. So I will choose this option right here. Now, in reference to CO2, we all know a bit about this, and this should be 9 nanometers, and ablative lasers tissue interaction with water. Well, I can choose if I can carry out ablation or heat transfer or thermal transfer. And the CO2 laser, in comparison with other ablative lasers such as air beam, have a lot of thermal transfers. I can create a lot of blood clotting or coagulation. In terms of CO2 full tissue interactions, I can create heating, biostimulation, coagulation, or clotting, always, so that we are safe. Fraction lasers create micropaths, and therefore the restriction inside is not 100% ensured. This is actually the old one, which was fraction lasers, and I've used it, and I had all types of complications. And with non-fractioned, it's very, very rare to create a scar. And that's because because you can always go over once, you can actually go over 2, 3, even 4 times or more, and have a nice rate of healthy tissue. And you could also do it in a stacking mode, and I can do 1, 2, 3, or 4 stacks, and that makes that the necrosis cone can be deeper, the dermatological effects can be deeper, and in some selected cases I will show you why I use it. So here is how the surgical handpiece works, and I will show you how I perform this when I use this with a surgical focusing and unfocusing, or the typical surfacing, or when I do a facial resurfacing. I prefer this handpiece because I can act faster. This is the aging process that we all undergo. We all lose 1% of our collagen tissue per year, and therefore we need to see how we can avoid it. And how, for example, with the EBD, I talked about the iron defect. It's like as if you would iron a wrinkled shirt. You can achieve this effect if you're aggressive with the CO2 laser. We can talk with some clinical cases. 120 millijoules, and after going over several times. In my team, what means low is several points, 125 points, and what is high means, for example, 300 points of application. And this makes it so that in the low, I can transfer a lot of heat. And with the high, I create ablation. So sometimes I actually play with these 2 intensities. Sometimes I can increase it, but you can see the effect of the periorbital wrinkles. It's quite the iron defect. So please try to even remove color from your images and see them in black and white. And that's going to give you a good evaluation or a good assessment. For example, this patient has quite accentuated wrinkles, and this is the quality of result being very, very aggressive. 120 millijoules with several, or going over several times. This is, for example, photo damage in this patient. Aside from the periorbital and periauricular wrinkles, I was a bit more aggressive in this case, and I chose 3 different types of effects or treatments. Coagulation, and that's when I actually increase intensity to decide and do an ablative treatment. You can have this series of results. Of course, everything should be at hand. And for example, in 1 week time, you will have scarring, or you will have a hematoma that will last 1 month, that you will have a post-wellness. But you need to know how to choose the patient, and that the patient can accept this all from the first session, and I can ensure the patient to have this quality of results. For example, this patient, I had already done a lifting, and she came back for a second lift, and I said, we should not work on the quality of the skin, but rather I offered to do 2 quite aggressive sessions with 190 millijoules. That's the maximum capacity of my equipment, and that's what I did with a medium of 120, a high of 120, and that's, sorry, this is, I don't have a close-up photo, but that's the iron effect that I achieve on my patients. So, what is a laser and RF blepharoplasty for me? This is without a surgery. I do this in my office for this patient. For example, this patient had a surgical indication. I actually showed her yesterday. She has multiple wrinkles, big eye bags, and she didn't want to undergo surgery. She's an old patient of mine. Therefore, I accepted the challenge, and these are the results on the first month. And this is the result at the 6th month. Yes, of course she has eye bags, but she doesn't have wrinkles, and she has a shortening in the upper eyelid. And look what we've achieved. But it's even more impressive because sometimes people say, well, the effect of lasers are in the short term. Well, this is the patient after a year of treatment, and there are still wrinkles that did not appear again. And well, this is a very loyal patient, and after 2 years we see that wrinkles did not reappear in just with 1 session. So please evaluate, because I think this is a good result that I've achieved, and obviously you need to evaluate cost benefits. This is the close-up of the patient I previously showed, so that you can also assess the shortening of the upper eyelid. There was no scalpels used on her. And look at what we've achieved in terms of the tightening on the tear trough. And you would say, well, she had a filler. No, this was exclusively done by collagen stimulation with CO2 laser. This is what I called stacking on the periorbital area. And what I do is just go over several times with heat, and you can obtain these type of result. Or this other patient, I applied a stacking on the temporal area, and look at the direction of the wrinkles beside the eye just by contracting in the temporal area. She manifested this, and for example, I didn't remember what she was treated with, and basically I did a stacking on the temporal area. Look at the crow's feet and how the eyebrow tip is lifted. And this is a young patient. She had surgical indication, but she did not want to undergo surgery, so I performed stacking on the upper lid. Always remember that it is the same as multiple scars. We cannot retouch on all the scars. For example, this is a patient of acne sequelae, and he came to me once a year, always during the month of May. And I applied this same treatment, and we achieved this ironed effect in the mandibular area. She's another patient. She's young, and she is also a patient of acne sequelae. And with just 2 sessions, we achieved this result in the marionette lines and the acne scars. These are frontal photos. I had the fortune of being invited to the SCARS Meeting 2021 conference, and I offered a talk about life-changing effects based on the treatment with these type of technologies. So I showcased a patient. She's actually the daughter of a colleague of mine, and she is fibropatric too, and that gave me the possibility to apply quite an aggressive treatment. And she basically states how her life changed being treated with CO2 laser. And look at her acne sequel. She didn't feel safe going out to the street. She actually wore a lot of makeup. And if you see the before and after, this was only achieved with 2 aggressive sessions. And look at this close-up, look at this black and white photos. And if you can see and actually count the acne scars, and you can see the quite significant reducing of these scars. I can show you a zoom in. Also black and white photos, and you can see the quality of the results with just 2 sessions. Other ways to obtain an extreme makeover with a CO2 laser is, for example, playing once again with the focus light length and a defocus light length. So look, for example, the case of an angioma with just pulsed light, I could not really advance because it was quite thick, because the mucose would be compromised. And aside from the CO2, you can, using CO2, we can work this much more nicer. And this is another image, so you can actually see the 3D effect that this lesion had, and how by playing this with the CO2 laser associated to IPL, we achieve this quality of results. And she cannot wear makeup. You cannot really improve a 3D image. And this is also with the surgical pinpoint coming up close and distancing from this angioma. And this is the before and after. If you have a level or degree of xanthelasma, for example, this is not indicated for surgery because the complications or the complication risk are enormous. And if I graft, this will be affecting the surrounding area. So this is priority of relative lasers.
Or this case in which you see the association of functional and aesthetic improvement, because I applied CO2 aggressively and I could reduce the diameter of the nostril and the way of the nostril. And you can see how the airway opens, and he wasn't able to breathe through that nostril. So now he was able. He gave more value to the functional than to the aesthetic. For me, CO2 is the main assistant for a plastic surgeon's office practice. It's versatile. It can also be for dermatologists. I use it every day. For me, it's for extreme facial makeover can only be achieved by CO2 lasers among the ablative lasers. This one, because of the important thermal transference. With a nerve you can do ablation, but no thermal transference. Nowadays, I am doing more therapies with the same team, such as ones that I mentioned, and please pay attention to the non-classical indications. Try to use them, make more out of the device that you are purchasing. And I state this to the patient since the beginning. Both of us are going to carry this, and we're going to do it, find a way to do it, okay? And for plastic surgeons, not many things cannot solved by the knife, but by the. Thank you very much for your attention.